Are you confused by the conflicting health reports in the news today? In this well-marketed world, it's hard to know who or even what to believe, but there are answers you can depend on. Hi, I'm Dr. James Markham. Join me for Bible RX, a program exploring the healthcare world, looking at all aspects of healing, using the Bible and biblical prescriptions as the ultimate source of truth.
Have you ever had a pain in the back, or have you ever been a pain in someone else's back? That's what we're going to be talking about today, pains in back and other parts of your body. No one likes to have pain, and part of healing is to get rid of all pain. I have a very special guest, Dr. Eric Olson. He's a chiropractor. He's going to educate us on how to avoid pains in the back. Back pain is one of the most prevalent ailments that affects our society. No one likes to have pain in the back. It messes everything up. You can't work, you can't sleep, your relationships, everything is destroyed when you have chronic back pain. Today we have an expert on chronic back pain, Dr. Eric Olson. We're going to answer questions about this. Eric, thank you for joining us.
Thanks for having me.
Tell me, what got you interested in the field of chiropractic?
Well, I guess to say I've always learned the hard way. When I was in my early 20s, I was trying to decide what I wanted to do with my life. I was into competitive bodybuilding at that time and felt that physical therapy would be a, excuse me, a good fit for me. And I was out doing some work one evening and ended up getting hit by a car.
Oh, boy.
And so I flew 30 feet over the car into a snowbank and ended up getting taken to a hospital on a backboard and all of that. And ended up having neck problems, shoulder problems, and low back problems with that pain that was referring down to my leg that people know as sciatica. And at that point, I started going to physical therapy. I was seeing an orthopedist and was trying to do anything I could to get feeling better. Unfortunately, I wasn't getting a whole lot
So you were
better.
having a lot of pain.
I was having a lot of pain. I was hobbling around on crutches. My orthopedist told me I'd never lift weights again.
Wow.
And it was a very discouraging time for me. And when everything failed, they said that my next option was back surgery. And at that point in time, that wasn't really a good option for me, being I was so young. My dad said, I'm going to take you to a chiropractor.
Okay.
All I knew, I grew up in a medical family, so all I knew about chiropractors is I heard they pop your neck and think they can cure everything known to mankind, and I wasn't really big on having somebody pop my neck. And so I told my dad I wasn't interested, and he told me he wanted me to go. And so I ended up going. And I can remember the first day, the man went over his angle on what was going on with me, and he laid me down on a table. He adjusted my back, and the pain went out of my leg.
Wow.
Immediately.
Wow.
Now, it doesn't always work that way for people, but for me at that point in time, it was it was just an incredible thing. And I said, would you do that again, please? And so I ended up going to him. I was going every day at the beginning as I started holding my adjustment. Longer periods of time, he's cutting me back on how often I went, and I got to a point where he said, you need to get back into the gym and start working out again. And so I kind of started seeing healthcare from two different perspectives. Right. And I just decided at that point in time that some of the conceptions that I had about chiropractic weren't true. They were really based on ignorance or what I had heard, but really didn't know they were factual. And decided to go to chiropractic school at that point in time.
Well, you know, there's lots of ways, and there's lots of healers out there. And we've talked about modern medicine. There's a place for that, chiropractic. There's a place for all sorts of healing. And I guess you found this out firsthand.
Yes, I did.
Well, we've collected questions from all over the United States and world regarding back pain and chiropractor, and we thought we'd answer them. Some of them we might not be able to answer, but we're going to do our best to try.
We'll give it a whirl.
This first one comes from Megan, and Megan writes us from Arizona. And she wants to know, what is a chiropractor, and do they just treat backs? Well, I guess, what is a chiropractor in your mind?
Well, a chiropractor, in my mind, and we have formal definitions of what a chiropractor is. You got in philosophy, art, and science, and all that. To me, a chiropractor is a joint doctor.
Okay.
A chiropractor looks at the back or the spine. We don't solely treat the spine or adjust the spine. You can adjust shoulders, you can adjust knees and ankles. Any joint can be adjusted
Now,
or
when you
mobilized.
word adjust, what does that word adjust mean?
An adjustment is what we do as a chiropractor. Some people will call it a manipulation.
Okay.
It's when people say, oh, they pop your neck or they pop your back. Sometimes a chiropractor will do it that way. They'll just find what joint is fixed, and they'll give a push in there to restore motion to that joint.
Okay.
You can do that manually. You can do that with other equipment, like what's called a drop table, a table I have in the office where it has pieces that will pop up, and you just give a push on a certain spot, the table will drop down, and you'll restore motion to that fixated joint that way.
Okay.
I do a lot of instrument adjusting in my office. It's nothing more than a little handheld instrument. People call it a little jackhammer, and you can set the tension on it, and you pull a little trigger, and the thing just taps. And it's no more pressure than that right there. You just find the joint that's not moving correctly, you get on it, you restore motion to that joint. But most importantly, the whole chiropractic premise is the fact that, you know, when we were created, they'll call it innate intelligence or, you know, a God-given intelligence, somehow comes down through our brain, down our spinal cord, and out our spinal nerve roots, right? You know that. And those spinal nerves control and coordinate every function of our body, to every tissue cell. So if there's a misalignment in the spine, and that's what a chiropractor calls a subluxation, it's just a misalignment, it's less than a dislocation, but that joint gets fixed. And when that happens, then it puts pressure on that nerve.
I see.
And it may not cut the function of that nerve off completely. It may just put enough pressure on there where just the proper signal isn't getting to that body part correctly.
Right.
And we call it a state of dis-ease, meaning a lack of ease.
Okay.
Left like that over time can lead to longer problems from, you know, you have tissue damage, can lead to a state of disease.
Right.
Okay.
Right.
So
mainly the chiropractor really just tries to align our bodies the way we're created.
yes, and just try to turn the power back on, remove the interference, let that signal get to where it belongs, and then the tissue will begin healing itself and the body will repair. We believe that the power that created the body has the ability to, you know, to heal the body.
That's excellent. Let's go to our next question. I hope that answered your question, Megan. The next one's from Raleigh in South Carolina. And Raleigh says, I think I might have slipped a disc. Should I see a chiropractor, orthopedics, or my regular doctor first?
Well,
I guess that's very individual, you know?
Yeah, that's an individual question. I mean, for me, I had disc problems. You know, that term disc slipping is kind of a loose term.
Yeah.
It does, you know, disc doesn't slide out and then slide in because it's attached to the vertebra above and the one below, but a disc can bulge, okay? And that's the problem that I had. I went to an orthopedist first, was referred to physical therapy, and then ended up at a chiropractor's office.
Okay.
Hindsight, you know, I would tell somebody, you know, what we do as a profession, as chiropractors, there's no harmful side effects to it.
Right.
So I try to say, well, try a chiropractor first, do drugs second, surgery last. So that would be my advice, would be to find a good chiropractor in your town, and go consult with them. If it doesn't work, you can work in conjunction with a medical doctor as well.
Okay, well, good. I think you've already answered this next one. This is from Caleb in North Carolina. He says, my doctor recommended I see a chiropractor for an adjustment. Is this an injection? He wants to know if it's a shot.
No, it's not a shot.
Is there any pain involved when, you know, you're saying you manipulate the joints, trying to get it along? Is there much pain with that? Because you would think, you know, if you're having pain to begin with, if you might have moved it the wrong way, there could be even more pain. And then you move it to the right direction, then pain goes away.
Sure. And then again, it depends on the person and how bad they are. I mean, if you have somebody coming in and they're all inflamed and they're bent over antalgic and it takes them, you know, a few minutes just to get to lay flat on a table with a patient like that in my office, I would prefer to do instrument adjusting because they can't handle much more than that. As they get better, then you can go to other forms of adjusting that are a little, say, more aggressive or whatever to restore the motion to that joint. Some doctors will never do that. Some doctors will just do instrument adjusting only. Other chiropractors will only do manipulative therapies. So I would tell a patient, you know, find what you think you're comfortable with. I do everything in my office. So when a patient comes into my office and if they've been to a chiropractor, I'll ask them, well, how have you been adjusted before? And I just try to stay within a patient's comfort zone. some people come in and say, I'm scared to death to have my neck adjusted. And I say, I understand. I was too.
Yeah.
And I'll show them an instrument, and they'll say, well, what's that? And they didn't even know that that was an option for care. And if there's anything that I could express to people is the fact that there are a lot of ways of being adjusted. And if you're fearful of having your back, your neck, they'll say popped,
Right.
manipulated, adjusted, then find somebody that does instrument adjusting. And you won't have to hear any of that.
Well, Dr. Olson, this is very interesting, very interesting. We're going to take a short break right now, and then we'll be back to answer more questions in just this brief moment.